This is persuasive speech, speech number 3. Parents with special needs children have much to worry about. Their children need specialized school programs. In addition, special needs children sometimes also need medical treatment. So the parents need all the help they can get when it comes to the education for their children. It has been reported by the Houston Chronicles that many Texas children who should be in special needs programs have been denied special needs services by their schools. According to Denied, this is a report by the Houston Chronicles on an investigation that they did. In 2004, the Texas Education Agency, or TEA, decided what percentage of students should get special needs services. To put things into perspective, if a child required special needs education, but the cap for the year had been met, the children would not receive special needs education because there was no more room. The cap had been met already. So our current special needs system in Texas is in violation of basic rights for individuals with special needs. The Education for All Handicapped Children Act was passed in 1975. After this was passed, this court rule says that free, appropriate public education to children with special physical, mental, or emotional problems, they have to receive these services for free. And because of this new policy, we're violating their basic rights for equal education. The TEA set an 8.5% target for special education, and they've been meeting it. They've stayed at 8.5 when the national average is above 13%. And this dropped only after they implemented their policy. So there are more special needs children that aren't being identified and aren't receiving the appropriate services, and that could possibly mean that they're failing. They're just being passed off as students who aren't trying, when in reality they're not receiving the appropriate help they need. So this 8.5 target has affected many children with special needs, but according to the Health and Services Commission, children with serious mental illnesses have been affected the most. About 500,000 school-aged children in Texas have serious mental illnesses. These children need specialized learning programs and learning environments, which they are being denied because of this target. Out of these 500,000 school-aged children with serious mental illnesses, only 30,034 received special needs help, because the other, not even half of them received the services that they need because they're above the cap that the Texas Education set. So now that we've gone over the main issues, I want to explain what the reasoning behind the benchmark on special needs programs seem to be. So this benchmark was done to save the school districts of Texas money. They placed this limit so that they could stay within budget. And it's as simple as that. It's very alarming because according to the Houston Chronicle, Texas children are now 31% less likely than the national average to receive services for mental illnesses. This is especially alarming because these children need help to deal with their serious mental illnesses. These mental illnesses affect their daily lives, how they interact with everyone in the community, and they especially affect their education. So in long term, not only are they being affected as students, also their families and their communities. Also, Texas and several school districts, or teachers in several school districts in Texas, reported that they've been ordered to discipline children who consistently act out instead of determining if they qualify for special education. So they're instructed to just discipline, to place under suspension, or just basic punishment instead of seeing what the real problem behind them acting out and not being able to function in the classroom. These children may need specialized help, but they are being set up for failure. And now that we've seen the major issues with the current special needs program for Texas children, let's take a look at some of the options or for solutions. One solution would be to immediately eliminate any sort of benchmarking, cap, or limit that tells Texas schools how many children can benefit from special needs programs if they need it, because this is a violation of the act passed in 1975. Last month, the U.S. Department of Education ordered Texas Education Agency to end the policy. They have yet to release a new plan. The new special needs education plan should seek to identify students with special needs and arrange for testing to ensure that they are being placed in an appropriate learning environment. Another solution to this issue would be to create a special needs program that would involve and keep the parents of the special needs students involved. As students with special needs have great potential, if they have a good home and learning environment, they're likely to succeed. Involving parents would also be great because it can be a way to ensure that these children have the necessary tools in their school to succeed, because who knows better than their parents as to what they need. So the policy clearly needs to end, and it's a clear violation of basic rights to a fair education system for all students, especially for those children with special needs. This policy has already been exposed by the Houston Chronicles, but the TA still needs to come up with a structured plan that would be fair for all students. Children with special needs and all children deserve a fair education that will work for them and help them succeed and help them be functioning members